Hi, everyone. This is Steve Elliott from ADHS. I am setting some things up here to make this go. I need to set up a bunch of people to record. I'll be doing that as we go. I want to make it clear that this session is on the record with Dr. Cara Christ. Please, there will be a presentation first, and then at the end we'll take questions. Please raise your hand to ask a question, sorry. Here we go. Dr. Christ.
Good morning, or good afternoon, everybody. I'm Dr. Cara Christ, Director of the Arizona Department of Health Services, and I really want to thank you for joining me today. We continue to work on vaccine distribution. What, check my mic? Better? Is that better?
Yep, there we go.
Oh, okay, there we go. Well, you guys missed the most important part. I'm Dr. Cara Christ. I'm the Director of the Arizona Department of Health Services, and I really want to thank you for joining us today. We continue to work on vaccine distribution in Arizona, and I wanted to about vaccines, how much we are continuing to get, and our ongoing plans for Arizona. Before I begin the presentation, though, I want to remind everybody that there's still a long way to go before we have enough vaccines for everyone who wants one. Until then, it's important that whenever you are with people that you do not live with, that you are wearing a mask and staying physically distanced. I'll take you through some updated information about vaccine and distribution, and we'll leave plenty of time for questions at the end. So there are some exciting updates about COVID-19 vaccines that we wanted to go over. The federal government enacted Operation Warp Speed to deliver tens of millions of doses by the beginning of 2021. Right now, there are two COVID-19 vaccine manufacturers that are expected to produce. Yes.
There's audio, but not from our mic. Is there audio now? Is there audio now from our mic? Can you do a test?
We're testing. Sorry, everybody.
1 second.
Okay.
Is that better?
There we go.
Is that good?
How about now?
We're testing.
Can you hear it now?
Does this work?
Can you hear it? I'm showing audio on my end now, still not here.
Okay, can you still hear me? Okay, perfect. All right. So we are, to date, 2 COVID-19 vaccine manufacturers are expected to produce the first doses of vaccine that will be available, and that's Pfizer and Moderna. Both the Pfizer and the Moderna vaccines will require patients to receive 2 doses of the vaccine, either 21 or 28 days apart, to be considered fully vaccinated. I want to remind everybody that while some protection will be obtained 2 weeks after the first dose, full protection will not be achieved until 1 to 2 weeks after the second dose. So that second dose is very important. And it will be important for everyone to continue taking precautions even after being vaccinated to ensure that we are protecting our loved ones and those around us. We anticipate that there will be approximately 40 million doses of vaccine by the beginning of 2021 and hundreds of millions of doses available by mid-spring. Importantly, there are no clinical trials yet conducted in children or pregnant women, so the vaccine will not be included in our phases at this time. As we get more information, we will be adding information about kids and pregnant women. So based on current information, the FDA's Vaccine and Related Biological Products Advisory Committee met yesterday on December 10th to discuss the data to determine if Pfizer vaccine may be effective in preventing COVID-19 in individuals 16 and older, and if the known and potential benefits of the Pfizer vaccine outweigh its known and potential risks. Based on the data, the FDA has indicated that they will proceed with rapidly issuing the EUA and has told the CDC to start preparing. We anticipate the EUA being approved either later today or tomorrow on Saturday. Once the EUA is approved and the ACIP recommendations are finalized, vaccine can be shipped to the states within 24 hours. We are currently anticipating that the first doses of vaccine will arrive between this coming Monday and this coming Wednesday. FDA has also scheduled a meeting of the Vaccine and Related Biological Products Advisory Committee on December 17th to discuss the emergency use authorization of a COVID-19 vaccine from Moderna. If this EUA is issued, we expect the first doses to arrive the week of December 21st. Again, just to look at what ACIP recommended, ACIP recommended prioritizing healthcare personnel and those residents in long-term care facilities, moving into essential workers in phase 1B, and then phase 1C is adults with high-risk medical conditions and adults that are over the age of 65. And again, they want to make sure that states are considering a fair and equitable distribution, that we're maximizing the benefit and minimizing harm, and that it's a transparent and evidence-based strategy. So the next steps that we are waiting for, we had the VRBPAC met on December 10th to discuss. We are anticipating that the EUA should be approved any day now, and that the ACIP recommendations should be finalized. And then we anticipate the first doses of vaccine arriving at the beginning of this coming week. And then we will wait to hear what the FDA's review of the data shows and if they'll be willing to issue an EUA for Moderna. So while we don't know exactly when we'll have enough vaccine available for everyone who chooses to be vaccinated to get vaccinated, we do know that next week we should start receiving the first doses of vaccine. And we've gotten more information on our vaccine allocation. So based on our current information, we're expected to receive a total of 384,350 doses. And that's going to come in the two different types, Pfizer and Moderna. For the very first week, we are only getting Pfizer doses. Given the small number of doses that we're expected to receive next week, these doses have been prioritized for healthcare workers in Maricopa County and Pima County. Approximately 47,000 doses will be going to Maricopa County and approximately 11,000 doses will be going to Pima County. And just to clarify, these are only first doses. So our federal partners are holding back the second doses of vaccine so that they can send them out within 3 to 4 weeks to allow individuals to get the same presentation of the vaccine that they initially got. The exciting news is that they loaded in our allocation for next week. And so next week's allocation will include both Pfizer and Moderna vaccine. And during this week, every county will receive doses of vaccine. On the slide, you can see how the doses will be allocated to each of our local allocating partners. In addition, the CDC Long-Term Care Facility Partnership is expected to kick off the week of December 27th in skilled nursing facilities across the state, and those doses are included in the order we are placing today. So the orders of this allocation are due by 5 p.m. today, and we're working with our local health departments to allocate those to the vaccinators. We activated the long-term care facility program for skilled nursing facilities initially only. We will be using the Moderna COVID-19 vaccine for this project. And based on our current understanding, 50% of the doses needed for that project will be pulled from the December 20th allocation, then 25% from the December 27th allocation, and again from the January 3rd allocation. But vaccination within our long-term care facilities will begin the week of December 27th. So we're very excited that we had a large number of our long-term care facilities throughout Arizona sign up for the CDC Pharmacy Partnership for Long-Term Care. The CDC partnered with Walgreens, CVS, and other pharmacy chains to support the vaccination of the staff and the residents in long-term care facilities. In Arizona, this will include skilled nursing facilities, assisted living facilities, and some group homes. This partnership will allow them to be vaccinated either at their place of profession, if it's the staff, or where they live, if it's the resident. And to date, over 2,000 skilled nursing and assisted living facilities intend to participate in the program. We continue to recruit and onboard providers to serve as vaccination in our vaccine distribution efforts. On September 4th, we rolled out the pandemic vaccine provider onboarding tool that was intended to facilitate identification and enrollment of healthcare providers who were interested in serving as COVID-19 vaccinators. Our vaccine providers are not just limited to doctors and nurses. We have a number of other types of healthcare professionals, including EMTs and pharmacists, that will be partnering up with us statewide to administer vaccine. And as of this week, over 1,200 providers have started the onboarding process, and over 500 have completed the process and are approved to receive vaccine. We're getting a lot of questions about how people can help, especially if they are licensed healthcare personnel. We do have a volunteer recruitment process. So those volunteers that are interested in serving as COVID-19 vaccinators to support the staff or those existing sites are encouraged to register at AZ ESAR VIP. This is our volunteer program for credentialed individuals. You should sign up for the COVID-19 group if you are interested in working on one of the missions. And we, from time to time, will send out calls for volunteers for specific missions. You either get an email or a phone call, and it's completely voluntary. You can choose to take it, or if other things are going on, you do not need to respond to that. But we would highly encourage any health professionals that want to assist with this process to sign up for the volunteer program. I'll go over the vaccine prioritization. I know I touched on this last week. We do facilitate here at the department a very similar committee to the FDA's. Ours is called the Vaccine and Antiviral Prioritization Advisory Committee. And it's really to make recommendations to the state about how to prioritize limited doses of vaccine or of a medication in a fair and equitable manner. So they review the federal guidance, they look at what ACIP is recommending, and they make recommendations for how the state should prioritize the initial doses of vaccine. So to briefly touch on it, phase 1 has been identified. Phase 1A will be the first group of, or the first populations to receive the vaccine. It includes healthcare personnel and support occupations, emergency medical services providers, and long-term care staff and residents. Phase 1B will be essential workers with teachers and childcare workers and public safety occupations that will be prioritized, followed by the rest of the essential workers. And then once we've vaccinated a good percent of that population, we will move into the high-risk populations, which include our adults with high-risk medical conditions, adults that are over the age of 65, and those that are living in a congregate care setting. So we touched on this a little bit last time, but I'll go over it again just to, because it does depend on where the vaccine's going and how it's being distributed. So Arizona is a home rule state, and each county and tribal health department reports to its local governing authority. So we have 15 counties and at least 4 tribes that have opted to be local allocators. We use a local allocator model for vaccine distribution. So our partners on the ground are the backbone of the vaccine program, and they will be the ones determining where the vaccine goes and where it is prioritized in their community. So just a quick overview of the vaccine distribution process. So the federal partners announce the number of doses that are available for the state in order to order in a given week. We divide this up based on the priority population among the various local allocators. And then the local health partner uses an ADHS developed allocation tool to place vaccine orders of their allocated doses. And they use that tool to specify the number of doses they would like sent to each pre-designated vaccine provider. ADHS collects all of the local orders. We place Arizona's order for vaccine with the federal government and telling them how many doses we would like to be shipped to each location. And then the federal partners directly ship that vaccine to the vaccine provider who will be administering those doses. Vaccine shipments are accompanied by the necessary supplies, including needles, syringes, personal protective equipment, patient reminder cards, and vaccine information sheets for patients. As vaccine becomes more widely available, the local allocators will no longer need to place those jurisdiction-wide orders, and the vaccine providers will be able to directly order through the ADHS ordering system, just the way they do with our normal routine vaccines. And again, I just want to remind everybody that there are some entities that will receive direct allocation. It's those partners that are actual federal entities. So the Federal Bureau of Prisons, the Department of Defense, the Department of State, Veterans Health Administration, and then our tribes can either opt to work with the state to be a local allocator, or they can opt to work with Indian Health Services to receive their vaccine allocation through that. All but 4 tribes in Arizona have opted to receive their vaccine through IHS, and we continue to work with our tribes to ensure that their needs are met. So each local jurisdiction is responsible for establishing their initial vaccine sites in partnership with local providers. So for most cases, a small number of regional sites will be operational to provide vaccination for our healthcare workers in the phase 1A priority group. For example, Maricopa County will activate regional points of distribution or dispensing, or they're also called pod sites, throughout the county for the phase 1A groups. So over the next several weeks, this will include 5 drive-through vaccination sites across the county. Healthcare workers will be notified by Maricopa County how they will be able to get a appointment and be able to to schedule their vaccination appointment. Pima County will be initially activating 2 pod sites to provide centralized vaccination for their phase 1A population. And as we expand to the other counties the next week, the operations may vary slightly depending on the jurisdiction. As additional vaccine becomes available and we open up the eligibility, strategies are going to look different across the different jurisdictions. Some may use employer-based vaccination clinics. Some may use, again, those high throughput mass vaccination clinics. When vaccine is more widely available to the general population, more and more healthcare providers will have allocated doses of vaccine. And so the local jurisdictions will use an array of mechanisms to communicate with community members on what phase they're in, on local eligibility for vaccine, and where those vaccine locations are located. We are committed to making as much information about the vaccine sites as possible available on our website. So similar to information about COVID-19 testing sites, we will communicate what phase the state in a whole is and where people can go get vaccinated. For the second dose reminder, the vaccine kits shipped from the manufacturer will come with a second dose reminder card. So local jurisdictions and vaccine sites are going to have different processes for conducting reminders. Some of them will be scheduling second appointments when the patients arrive for their first appointment. Others may use electronic recall systems or even pass out the card to remind people that they need to get this second dose. So under Executive Order 2020-57, providers in Arizona are required to report information to allow ADHS to monitor the rollout of the program and determine the vaccine coverage among our population. And this specific information includes patient information, vaccine product information, such as the manufacturer and the dose number, the route that it was administered, the date of the immunization, information about the facility that's providing the vaccine, and then the priority group that the patient is in so that we can monitor the coverage through that priority group. ADHS has also signed a data use agreement with the Centers for Disease Control and Prevention so that we can share limited aggregate data with them so that they can do appropriate follow-up and allocation. As we get this information, it's going to allow us to ensure that we're reaching our underserved populations and our high-risk populations. And it will also provide information on the individuals so that we can make sure they get the appropriate second dose at the right time. We're also in the process of finalizing our Arizona vaccine management system. This system will allow for pre-screening, appointment setting, and vaccine reporting. It will also allow for second dose reminders for people who have scheduled through the vaccine management program. It's currently under user testing and our partners are undergoing training. As of today, we are anticipating that this system will be ready to go live on December 14th. One of the other exciting things that we are working on is we're coordinating with the Arizona Poison and Drug Information Centers and 211 to provide them with information on how to answer and provide information for calls from the public and healthcare providers about vaccine. The poison centers will also be a key partner in providing information about vaccine safety and any adverse events associated with vaccine. And we've engaged with a partner organization to conduct surveys of healthcare workers and the general public to better understand their perceptions about COVID-19 vaccine, their intentions to be vaccinated, and their trusted sources of health information. By gathering this information, it helps us develop targeted communication strategies in partnership with our experts in the local jurisdictions to communicate with Arizonans and be able to address questions about the vaccine. Because we need as many people as we can to roll up their sleeve and get the vaccine. And we also need to let everybody know that the vaccine is safe, effective, and it's for everyone's benefit. So the surveys went out to both healthcare providers and the general population and included questions about vaccine confidence, hesitancy, and trusted sources of info. We received the data back, the healthcare providers. And the survey was promising. It identified that 55% of healthcare providers were likely to get the COVID vaccine based on what they knew right then. 37% were unlikely and 8% were undecided at that point. The key takeaways of our surveys showed that most healthcare providers are willing to take the vaccine. Some of them were worried about being the first to receive the vaccine. They felt that if a vaccine, the more concerned that somebody is about personally contracting COVID-19, the more willing they are to take the vaccine. And we need to create a campaign using the most impactful messages to educate who have concern or unlikely to take the vaccine to increase the willingness to be vaccinated. Messages from somebody who already took the vaccine was also one of the best confidence boosters for healthcare providers. So encouraging those who have been vaccinated to discuss the vaccination with their colleagues may help improve vaccination coverage. So as a brief summary, Arizona's initial vaccine allocation should be arriving the week of December 15th. Arizona's Vaccine and Antiviral Prioritization Advisory Committee convened to recommend a state allocation plan based on a local allocator model. This now has been posted on our website, and you can see the recommendations. Executive Order 2020-57 provides more information on vaccine reporting requirements for providers, and a vaccine management tool will be available starting next week. And the ADHS COVID-19 vaccine webpage is live with updated FAQ. Not live with you in the home, please wear a mask. To come up with the second part of your question, Rachel, there is the safety profile so far reviewed looks very good. We do always know that an allergic reaction is a potential side effect of vaccine. We're continuing to monitor what the UK is experiencing. One of the things for our vaccination sites is that people will be required to remain on site for about 15 minutes after, so that we can ensure that there isn't a reaction that needs to be taken care of or a medical emergency. And then we will be reporting any adverse reactions through VAERS, or the healthcare providers will also be doing that, so that we can make sure that we're identifying any common themes. But so far, the safety profile looks really good.
Thank you. I'm trying to unmute Howie.
I don't know why. I think you keep knocking me off of here purposely.
No, I can hear you now, Howie.
Good. Hey, two basic questions, and a lot of this relates to the issue of when you've got healthcare providers that are hesitant about taking this thing, and we're trying to reach some sort of 70% herd immunity. I mean, if healthcare providers themselves are hesitant, why would you think members of the general public, particularly in a state like this where you've got anti-vaxxers and you've seen all of this, what makes you think we're going to get anywhere near even 50%?
So do you want to ask your second one, or do you want me to?
No, let me come back to second.
Okay, perfect. So we're very encouraged by the data that even before the data became public, over half of our healthcare providers were willing to accept the vaccine. We will work with our healthcare providers to continue to answer any questions, to provide data that's available, and to encourage everyone to get the vaccine, because it's very important, one, for their protection, but also then to be able to encourage and communicate that to the general population. We know that there is vaccine hesitancy out in the community, but we do need to achieve high levels of vaccination in order to be able to protect the community. So we will be working with our healthcare providers as well as our local community partners to ensure that that we get as much vaccination going as possible. And your second question, Howie? Perfect.
Okay. Can we ever get to 70%? I know we asked this, my colleague Bob Christie asked this last time. We seem to just glossed over that. I mean, what's your realistic percentage of where we're going to get to?
So we would like to get to 70% or even higher. You know, flu vaccine varies with our uptake. Sometimes we'll fall anywhere between 37 and 50% of the population getting vaccinated. It may fall somewhere in there. We may have like a 40 to 70% vaccination rate. And we are going to keep working and, you know, communicating to our local communities about the safety and the efficacy of the vaccine. And we'll keep monitoring to see what our coverage is in Arizona.
Okay, next up is Peter Seymour from KTAR.
Thank you. Yes, I appreciate you putting the other microphone there because, yeah, it's been cutting in and out. So I have three brief questions. I promise they'll be brief. Number one, Dr. Christ, when you say 384,000 doses are coming to the state, are those only first doses or are those second doses as well? I know you addressed this earlier, but we'd appreciate a little more clarification. And then, like I said, a couple more unrelated questions after that.
Sure. So the 384,000 doses that are coming are the first doses. So the federal government is sending us those doses and holding back the second dose. They will then, in 3 to 4 weeks, depending on which vaccine, they will send us the second dose, another 384,000, so that we can get that first group their second dose.
Got you. What's the lag time between getting the doses in Arizona and administering them? When they get on the ground here and then getting the providers and getting them into people's arms?
So we're hoping that when we receive the total allocation, that our vaccination clinics, it will likely start with about 4 of the pods statewide. We would like to have those operational within 24 to 48 hours.
So 24 to 48 hours, once they arrive, they're distributed and they're in people's arms. So less than a 2-day turnaround, perhaps.
Yes, so that's what we're looking at. We're looking at receiving the doses sometime between the beginning to middle of next week, and we're looking to start vaccinating middle to end of next week.
Last question, I promise. How does the state qualify volunteers to administer shots? You touched on this earlier, but a little more detail would be much appreciated.
Right. So that vaccine, that's a great question. So that ESAR VIP program actually goes in and verifies the credentials of people who are volunteering to sign up. And then based on their credentials, we'll prioritize them based on the activities. So we will verify that that person has a valid nursing license or a valid doctor's license in order to be able to practice in the state of Arizona. And so when our partner organizations request volunteers, they know that they are getting licensed and eligible providers to be able to provide whatever service they're asking for.
So they need licenses, whether they're doctors, nurses, or other type of healthcare provider, to provide a vaccine.
No, so that's, I guess, so that's how the system overall works. You don't need to be a licensed, like you need to have a licensed person overseeing the administration site. But we are working with pharmacists, with EMTs and first responders, and then doctors and nurses are all eligible to give those vaccines.
Thank you very much.
Yeah.
Okay, next up is Cameron from 15.
Okay. Hi, Cameron.
Hi, Dr. Chris. Just wanted to ask you about the reordering process. So obviously a lot of this is going to hinder on how much supply we have, and obviously that it keeps coming for us to continue to vaccinate folks. So is there a designated day when vaccine will be reordered? How will these providers let you know how much they have left versus what they need? Is there a number that they would hit, that they would say, okay, it's time to reorder, we have only another 970 doses, or what that number would be? And is there a max to reorder, especially once private providers are ordering?
So we manage our state's vaccine inventory for the Vaccines for Children and Vaccine Adults program through our ACIS program. So that's the Arizona State Immunization Information System. So that's our registry. Providers are in there. They track and monitor the doses in that. The department can see what those providers have. That's part of the onboarding for providers who want to provide COVID-19 vaccine. So we'll be monitoring that and approving the orders. So if a provider still has a large number of doses that they haven't given and they place another order, we may call them to find out why they didn't use the initial doses, or if they've got some kind of big event planned that they need additional doses. And then we'll be watching and working with our county health departments, who initially will be allocating it out, and we'll be making those orders. What we understand that happens is the drug manufacturers will be notifying the federal government over the weekend of how many doses they have. That should go live in our system at the beginning of the week. We will work with our local allocators to try and get that out Tuesday or Wednesday so that we can make sure that we meet that 5 p.m. deadline. That appears to be how it's worked the last couple of weeks and how they anticipate it working for the next couple of weeks.
Next, we have Wendy Redmond from Tucson.
Hi.
Hello, Dr. Christ. I have 3 questions for you, if it's okay. The first one is, we talked about this a little bit last week, but for out-of-state people, even for out-of-country visitors, we get a ton from Canada. You mentioned that they can get the second dose here, but a lot of questions about, can they get a first dose here? And then also, to go along with that question, how do we prioritize them versus Arizonans to make sure that we have enough doses?
So yes, out of state residents or out of country residents or people who are in Arizona will be eligible to receive vaccine, both the first and second doses. Especially, they would be prioritized not based on their residency status, but based on what priority population they fall into. So if it's one of our winter visitors and they're over the age of 65 or have a high-risk medical condition, they would be prioritized in that 1C group. If we have, one of the initiatives that we're working with our hospitals on is getting traveling nurses from out of state to come help and provide nursing support at our hospitals. We definitely would want those individuals, even though they're not residents of Arizona, to be eligible in the healthcare vaccine prioritization group. So they would be included in the 1A if we are able to be able to contact them and reach out. So we're working with our healthcare systems, but that's how we would prioritize it.
Okay, great. My second question, how are we preparing our hospital staffing situation as we give our frontline medical workers this vaccine in just a couple of days, knowing they could be out for a couple of days with a fever? And a lot of our hospitals, as you know, here in Pima County are at or near capacity, and it's really all hands on deck. So it's kind of hard to think about losing a significant number of them for a day or two.
Yes, and that is a concern. We've been working with our healthcare partners to discuss the need to stagger their healthcare workers. So you probably don't want all of the emergency room physicians going in at the same time to go get their vaccine, because we know that there are side effects. Development of a fever, feeling kind of run down, that's your body's normal response to an infection. So it does that when you get vaccine. So these are normal anticipated reactions. But with a fever, we would not want a healthcare worker with a fever at work, even if we suspected it was due to the vaccine. So we are working on bringing in those additional nurses. I think we have 300 nurses coming into the state over the next couple of weeks to make sure that we've got that support and those additional resources in case our healthcare workers, the other thing that we're hearing is that our healthcare workers are also coming down with COVID-19 because it's in the community. And so we do know that we've got call-offs. We know that we're going to be adding to that with the vaccine efforts. But for a short period of time, it's worth it to get this population vaccinated as quickly as possible.
Perfect. And then my final question, if you could address this, we don't know what to tell people right now. They're asking us, why are we not rolling back business openings with counties completely in the substantial categories? Wasn't that the whole purpose of the benchmark? What do we tell them?
So I would tell them that, where we're seeing the most spread as we're doing our contact tracing is with those small, intimate groups where people feel comfortable to take off their masks. We are still operating at reduced capacity for those establishments that are regulated under that executive order and our emergency order. We continue to require those facilities to require their staff and their patrons to wear masks. They're operating at reduced capacity. They have to do enhanced cleaning and disinfecting protocols. There's a large list of rules that they have to follow. We are increasing our enforcement. So it's a 2 strikes, you're closed kind of system. And we are in the process. This was the first week. We had 4 establishments that were given a first strike notice.
Next, we have Randy Gruen. I hope I pronounced that right.
Actually, Randy Gruen looks a lot like Matt Galko from Fox 10. I'm using his computer. I'm using his computer. But hi, Dr. Christ.
How are you?
this might be a more so of a technical question here, and if you want to reduce it to Maricopa County, that's fine, or go statewide. But I imagine that you guys have a number for how many people might fall into phase 1A. I imagine you have some sort of ballpark. Can you share that with me?
Yes, I sure can. So again, these are going to be ballparks based on like the number of people we anticipate the National Bureau sends. If you look at our website, we have posted this document, which is the recommendations from VAPAC. And if you go to the very third, it's the third page, and it's got our priority population tables. We have estimated numbers of that in there. So for our 1A, we're anticipating around 184,000 healthcare workers, about 70,000 healthcare support occupations. So those are the staff that go around our healthcare professionals to ensure that the facilities and the hospitals are operating. And you can see these are approximate numbers, though we know that we probably don't have 100% of the healthcare workers, but we also know that 100% of the healthcare workers aren't going to be able to be vaccinated. Some of them may have medical conditions. There may be other contraindicating things that may prohibit them from getting it. So we use this to kind of identify what the overall scale is. And we do have this broken down by counties so that we can help allocate the appropriate percentage to the counties for these priority populations.
So are you anticipating any sort of surplus at all, or when it comes to these populations, and how do those get doled out?
So we anticipate that as we start vaccinating more and more of the healthcare workers and the long-term care facilities, and as we continue to get more vaccine in, what we'll be able to do is gradually move in people from the next priority group. We want to make sure that we're not leaving appointments on the table. So they may open it up. Say we're doing our 1A group. We've got our healthcare workers. We've got our healthcare personnel occupations, and we start to notice that the appointments aren't filling each day. They may reach out to the teachers or to law enforcement to start scheduling those appointments so that we can fill it up, but even before we officially move into the next phase. So that will be on an ongoing basis. Kind of think about it. One of the doctors, she's wonderful, but kind of gave us the similarity. Think of it like an airplane, right? You've got a confirmation, you've got tickets. As there are available seats, they'll pull on standby passengers, and that's kind of the system that we were looking at using.
And then my last question is, the hope is that everybody comes back for their second shot. If they don't, is that second shot, I don't really know the science of it, does that become somebody's first shot, or it has to be somebody's second shot? And at that point, you don't have the right numbers, it sounds like. So what happens then?
So if somebody doesn't come for their second shot, if it's the same day, that's totally fine. You can go a couple of days after. It's really a long length of time before, and I'd have to look at the specific vaccines and what their recommendations are, but usually it's a longer period of time that it doesn't count as a booster for the second dose. And what we would do is we would work to recall those individuals and try to identify where they were so that we could get in touch with them. I think one of the concerns is, if the winter visitors get their first shot here and return back to Minnesota or Canada, how will they know? So that's why we were trying to get that data sharing agreement, but really trying to communicate the importance of the second dose. Now, the first dose will give you some protection, not as much as 2 doses will, but the first dose will give you more protection than you had without it.
Thank you.
Next, we have 12 News. I think Joe Dana.
Okay.
Yes, hi, Dr. Chris. Thanks so much for the update on the vaccine, and a couple of other questions related to your purview. A group of physicians just appeared together a little bit ago to beg the state to eliminate indoor gatherings. What would your response be to them?
So we are continuing to monitor the data and make recommendations. Our recommendation already is to limit indoor gatherings, to keep it very small. I myself keep gatherings for me less than 10. But there is an executive order prohibiting more than 50 people getting together. So we encourage people as they're developing events to really think about limiting the size and the number of participants in there.
Indicators are the virus is spreading faster in Arizona right now than in any other state. We've also seen school districts this week in crisis, a superintendent abruptly resigning. There's a lot happening just in the last few days. Why isn't Governor Ducey with you today to talk more broadly about this ongoing crisis? And what did he tell you the last time you spoke to him?
So the reason he's not with me right now is we wanted this to be a discussion on vaccine and to talk about what our plans are and the expectations that the state has for receiving vaccine and getting it out. And so we have talked about the current trends. So, you know, what we're seeing with percent positivity, what we're seeing with the cases, really where we're identifying some of those key areas of spread, you know, and we are concerned and watching what's going on, not only in Arizona, but around the country as a whole. You know, Arizona is not unique in seeing this. If you look at California and Florida, their curves are very similar to Arizona's. And so, you know, we continue to make recommendations based on what we're seeing here.
Has he indicated to you the next time he was willing to appear for a public news conference on this?
Oh, I don't know his schedule. I know that he does appear in and answer questions. So I don't know what his
Next
schedule
time,
moving
okay.
forward is.
And then one of your colleagues in the public health community, State Representative Nancy Barta with the Health and Human Services, she just this morning, she tweeted content that say masks don't work. You've got Andy Biggs, a Congress member, who's asking to unmask Arizona. How frustrating is it for you to see elected leaders in this community with large followings contradicting the basic instructions you're trying to get to Arizonans?
So it makes the messaging difficult. There are scientific studies proving that masks not only reduce the risk of me potentially asymptomatically transmitting it to those around me, but there are also studies now that have scientifically proven that it protects me by wearing my mask in case anybody else is asymptomatic and could be spreading. We would encourage people to find reputable websites such as the Centers for Disease Control and Prevention, the Arizona Department of Health Services website, or your local health department's website to really get the facts and the data on mask use.
Last question, I appreciate it. A large amount of Californians are coming into town daily right now. How does the state keep track of them? Are there attempts to try to educate them or track them as they flood Arizona?
So no, we're not tracking or like requiring people to register as they're coming into Arizona. As they utilize Arizona services, they will be required to adhere to our establishment rules, local mask mandates, and we continue to work with our establishments to make sure that they are requiring masks. So it really doesn't matter where you're from. No matter where you're from, you're at risk for getting and potentially transmitting COVID-19.
Thank you.
Nyala Charles from 12 News.
Yes. Hi, Dr. Chris. Thank you for taking my question. So recently, about 2 days ago, the Pinal County Public Health Director released a video telling residents to, quote, "Please do not stay isolated. We encourage you to have human contact, to be with your families this particular Christmas season." Now, she, along with the sheriff's office, is pointing at mental health issues increasing because of COVID mitigation efforts. So it seems that's the reasoning they're giving, but do you agree with that statement?
So we have encouraged encouraged since the beginning of the pandemic to stay socially connected. It is so important. We are seeing increasing mental health issues. So we would encourage, find unique ways to make sure that you're connecting with your friends and family, but at the same time, keeping them safe. So if you want to get your family together, absolutely do so. If they don't live with you, just make sure you're wearing masks and that you're staying physically distanced, but you can still be together in the same location. We would recommend keeping those groups small. So maybe if you have a large family, maybe you do multiple groups of less than 10 people wearing a mask. And you can always encourage those that are high risk or potentially recently exposed or currently sick to attend virtually so that you can still see them, you can talk with them, they can see everybody, but they are safe. As we continue to get additional vaccine in the state, that's kind of the light at the end of the tunnel. It's still several months off, but we just want to make sure that we're protecting Arizonans.
So do you feel like that can be done in a responsible way, given the messaging after seeing the increase in COVID cases that we've seen since Thanksgiving, for example?
So it can be done in a responsible way, and it's really limiting the size of your groups and making sure that you are following those mitigation strategies of masking up, staying physically distanced, and washing your hands or using hand sanitizer. I know that when I'm around, even when my family's there, I always have my hand sanitizer on my belt or my purse so that I always have hand sanitizer available. And so there's little tricks like that that you can do to try and keep you and your loved ones safe.
Okay.
Next up is Kathy Ritchie from KJAS.
Hi, Kathy. Hi, Dr. Christ. How are you?
I'm good. How are you?
I'm well, thank you. I do have a question about the long-term care community. I understand that the vaccine, while it has been tested on older individuals, 65 and older, it hasn't specifically been looked at in individuals who reside in long-term care who typically have other underlying health conditions. I'm just wondering, how are you communicating to residents and their families about this vaccine? Because if it were me, I would be concerned about that. And then also, how are you addressing potential staff concerns? I've seen comments on social media from CNAs just expressing concern because, the vaccine came quickly, even though the science has been around for a while. They are at the front of the line, and it's a real concern. So I'm curious how the state is working with communities to educate not only families and residents who may have other underlying health conditions, but also staff, and ensuring that it'll be okay if that's the case.
Yeah, so we're developing communication that's targeted to our healthcare workers and the general population. Obviously, our residents at our long-term care facilities are a high priority because they are so vulnerable to this disease. So we'll be working with our pharmacy partners to ensure that information is getting out. By law, they have to give out what's called a vaccine information sheet that provides the information about the vaccine, the disease that it's preventing, what the potential risk factors are, what the potential adverse impacts are, and how to report that. So that people have all of the information that they need in order to be able to make that informed decision. We are not mandating vaccine for anybody, so people can decline. It's not going to be a mandate in these facilities. And even if they don't get it the first go around, that doesn't mean that they're prohibited from getting it once we move on to the phases. Those individuals will always remain eligible if they do decide to come back. But we would encourage them to look at websites such as the CDC's, the FDA's, our website, if they have questions, or to reach out potentially to Poison Control, 211, or the FDA's call center if they have specific questions about the vaccine.
And just a quick follow-up, thank you for that. I know somebody had asked a question about medical personnel developing a fever and possibly being out as a result. As you know, long-term care facilities have always suffered from a not very deep bench when it comes to their caregivers. Are there plans in place to have caregivers, CNAs available should staff take the vaccine and become sick as well?
So we are looking here at the department because we are hearing that that is a potential barrier. One of the things that the pharmacy program will be doing is staggering when they go. So the first dose at a specific facility will be rolled out over multiple days. So they're not doing the entire facility in just one day. And there is always the ability for a hospital or a long-term care facility to submit a resource request through their local health department. And that resource request can include personnel. And then that's when we would either work to identify volunteers through our ESAR VIP program, or to see if there were other resources that we could staff and make sure that they had the appropriate number of staff in order to keep the residents safe.
Thank you. Do you have time for one last quick question?
Yeah.
Regarding Debbie Lesko and her letter to CMS about the visitations, that some lawmakers had said that that's not happening. And I just wanted to get some clarification from you, because there is the long-term care task force, and it seems like some places are allowing visits, but other places are not. Is there clarification, or does that need to be modified?
I would have to take a look at the letter to see specifically what it said. So CMS does have visitation criteria. They do know how important it is for families to see their loved ones that are in these facilities. But it is dependent on the percent positivity and the spread in that community. And so we developed also the long-term care task force that you're discussing. We developed criteria for that as well. And so we would encourage the facilities that if they're in a phase that allows them to have visitors, that they do so, but that they implement the mitigation strategies, because we also know that it is in the community right now.
All right. Thank you so much for your time.
Zahid at AZ Family.
Okay.
Actually, it's Dennis Welch with the AZ Family here. I'm using my boss's email here today. So second one. And so Dr. Chris, I do want to follow up. I mean, you know, you start looking at the data here in Arizona with the spread of the virus. It's growing exponentially, you know, leading the country and whatnot. But earlier, I believe it was Rachel who asked you, you know, what's the next step? You basically said it's more of the same. You said, wash your hands, keep your distance. It's, you know, it's the same mantra we've been hearing over and over. It's clearly, it's not working because we are seeing this spread. What are you recommending to the governor to mitigate this spread in the meantime, while this vaccine can take hold? And what are you specifically, you know, advising him or asking him to do? And if you haven't requested anything, you know, to any more mitigation measures, why haven't you?
So we are working. So there's several strategies that we are looking at as a multi-pronged approach to try and bring the infection rate back under control. So I told him one of the things that we really need to do is enforce the utilization of those mitigation measures, because we need our establishments or places where people can congregate to follow those so that they can reduce the risk. One of the other things that we've talked about is limiting where people can congregate without those mitigation strategies. And so that's what resulted in the executive order that requires the cities and towns to post the plan so people can see if the event that they're going to that's over 50 people has mitigation strategies in place and how they're going to enforce that. And then they're reporting that to the department so that we're aware of what events are going on, and we can include that in the contact tracing. What we are identifying is it's those small intimate gatherings when we're doing our contact investigation where we're finding transmission, and that is a very, very difficult place to either regulate or enforce in people's homes. And so that's why, again, you know, you'll hear me say about the masking up and making sure that you're staying physically distanced, because we're not tracing a lot back to some of those other congregate settings.
Would you say that campaign has been a success given where we're at right now, the encouragement of the Mask Up campaign, or do you think we need more than where we're at now?
You know, I think it worked so well previously. And I think what's happening is people are letting their guards down in what they consider familiar, trusted places. And I think we need to remind everybody that when they are with people that they do not live with, And that has we've gotten stronger about that recommendation. Before it was, if you're in your home and you don't need to wear a mask. Well, now it's, if you're in your home and somebody else is in your home that doesn't live there, everyone needs to be wearing a mask. And so again, you're looking at places that are very difficult to enforce or to require masks be worn. So that makes it difficult.
And final question, millions of dollars have been shelled out from the governor's office to hire more staff for hospitals. Again, if you could just repeat how many people we need for the hospitals you want to get and where we're at in this situation, given all the competition for healthcare workers across the country.
That's a great question. So there's a couple of phases that we're working on concurrently. So we are bringing in about 290 nurses. That was remaining funding from over the summer. We started on that. But we're also concurrently working on bringing in an additional 500 nurses in order to meet the needs. We also provided financial assistance to our big receiving hospitals because they indicated that they didn't have as many issues trying to recruit staff, but because it was getting so competitive and so difficult, that they needed the additional funding would help them be able to support the bigger increase. And so we've been working on all three of those concurrently. It sounds like Banner was able to bring or identify a number of individuals that are coming in, and we will have 300 of those total 800 coming in within the next couple of weeks, and with more to follow. So in the next couple of weeks, we should have more resources here in the state.
Thank you very much, Doctor.
Our last question is from Jonathan Cooper at AP.
Oh.
Yeah, Dr. Christ, you said several times that the transmission is happening in smaller, intimate gatherings. And I'm wondering how you know that, because we know that, contact tracing is fairly limited. And we heard early on in the outbreak that, sorry about the baby, that, it's hard to trace where people are getting infected. So, how do you know that it's not happening in bars and restaurants, and that it is?
So yeah, so that it is interesting, especially since we anticipate, data from the CDC shows that approximately 50% of those are coming from asymptomatic individuals. But when we are doing contact tracing, and our contact tracing has actually grown, or a contact tracing program in Arizona has grown significantly since the summer. So here at ADHS, and this does not include all of the resources in the counties, we've brought on 600 people to do contact tracing. So we are following up with cases. We are following up with their contacts to identify potentially where they've been, who they've come into contact with, and then for those contacts to make sure that they're not sick, that they're actually doing okay, and give recommendations on what they should do if they do become sick. So we are identifying some of those smaller household gatherings. We're identifying, sports as potential source of transmission. It's harder in a restaurant because you may not know how close you came. So we continue to utilize like the national data for that, but we are identifying some of those sources of infection.
Okay, everyone, thank you. And thank you, Dr. Christ.
Well, thank you everyone for joining us. We really appreciate it.